Good afternoon. I'd like to call to order the Health and Human Services and Aging Committee meeting Wednesday, May 17th, almost 1:10. Can we have a roll call, please, Madam Clerk?
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll for Ms. Conwell.
Present.
Mr. Sweeney.
Present.
Ms. Stevens. Ms. Stevens is absent at the moment. Ms. Turner. Ms. Turner is absent. Mr. Miller.
Here.
You have a quorum.
All right. Madam Clerk, has anyone signed in for public comment?
No, Madam Chair, no one has signed in.
I hope Ms. Lou is doing well today. And Will, you don't have anything for us today? All right. Approval of the minutes from the May 3rd. I'll make a motion. Is there a second?
Second.
Approval of the minutes. We have a motion and a second. Conwell and then Sweeney. All in favor, please say aye.
Aye.
All right, we have 3 items before us today. Madam Clerk, if you could read the first item into the record.
Resolution 2023-0126, awarding a total sum not to exceed $70,000 to the Greater Cleveland Faith-Based Initiative Group for the purpose of Project REACH Anti-Violence Program from the District 8 ARPA Community Grant Fund.
All right, and who is presenting for this item? Please state your name for the record.
Good afternoon. I'm Reverend Eppinger, President of Greater Cleveland Faith-Based Initiative Group.
All right, Reverend, can you please share with us what your,
Yes, Councilwoman Conwell and Councilman Sweeney and Miller. Our company, Greater Cleveland, Greater Cities Faith-Based Initiative Group, is 15 years old. We started working in the community, and some of the programs that we've had over 15 years have been mentorship through the True to You program, where we've mentored 8th grade kids in the nature of over 25,000. We work with Catholic Charities with our food programs, Wow You, where we've hired 1,500 kids, and we've served 80,000 meals, among other programs. Violence is at an all-time high. So what we thought we'd launch our movement at is ways that we can curb violence, not only just in the county, but across the country with our cities program and the city. In beginning with the county, the proposal that I have is that we might begin looking at violence in several different ways. We have 5 initiatives that we're going to do with this $70,000 grant. They are literary campaign. The literary campaign will allow us, with 10 churches that we're using, to be able to every month talk about one of the violence initiatives, be it gun violence, violence against women, workplace violence, and so forth. In that, what will happen is the average church that we're working with out of the 10 have about 300 members, and their network that they'll be dealing with when we look in terms of social media puts them into their thousands. Through that, every month they'll be talking about a violence initiative, which is simple. We're just sending them information. Their secretaries are posting it, and we look good in terms of involving people. The next program that we have is town hall meetings. These 10 churches, every 4 months, will have a town hall meeting, which would include political people, business people, education, also those that may be involved in gangs. Every community don't have gang problems, but gangs, and then in addition to that, the faith-based community and the community at large, that they might talk about the things that are happening. We did it in the Warrensville area, and out of that meeting that we were having, it talked about putting in new traffic lights. It talked about areas where there were hot spots that the police need to patrol, but it was a good engagement with the community, engaging those people who are political, law enforcement, and so forth. The next program that we're going to do will deal with youth employment. We will have at least 10 students working with YOU. As I said, in the past, we've hired 1,500 kids, that they will be at the churches working. In what capacity? Catholic Charities allowed me to serve 80,000 meals, and they're going to provide food for summer programs for those locations that they will be at. Out of that develops some interesting jobs. Jobs, data entry, jobs dealing with mentorship, where we have mentors on the campus. I wrote a book called How You Go From a Job to a Career. We'll be actually teaching the kids that we're mentoring there during the summer out of 6 weeks, how they go from not only just a job to a career, but how you dress for success, how you have the language of employment. And then in addition to that, they have monitors because they're taking them on field trips. So we're creating jobs and teach them during this 6 week period, and also other people coming from their church. So the fourth program is the mentorship, and then fifth, Agape Awards. There's a stream of money that's included that at the end of the year, those who have been at the town hall meetings, those who have been at the summer employment, those who've been involved in the mentorship will be getting some type of award for about 100 people, and we're buying the awards, where they would have brought the whole community together within a year to celebrate those who've been involved in the community, and also look at ways that we can work together for future projects. Sustainability. I know this is just a 1 year, but we're looking at applying for federal dollars with the $5 million legislation that President Biden is providing for anti-violence that we might, and you could probably help us later on down the road with that, where we can look at sustainable programs. Simplicity. We didn't want to look at something being hard to do with churches, but something easy to do. We've done it before. We received a $450,000 grant from the Cleveland Foundation, and we were able to empower churches to do the same thing during summer initiatives, and we want to do it again.
He's writing notes down.
Okay.
I didn't get a chance to write all my questions down, but, so the 1 year pilot will, and then you would try to go for a Biden grant.
Yes. And we're already in the process of applying for those dollars through Congresswoman Brown. And then in Columbus, we're looking at Congresswoman Betty, because as I said, we're across the country and people that we're working with.
Did we have a conversation about this before?
No, we did not.
Okay. I'm mixing it up with something else. And who would those 10 churches be?
We haven't decided which churches we want to wait to make sure that the funding was available, but we have decided where the areas that are hotspots that we want to start. And it's amazing all of you are here. We want to go with, out of the 10 churches, one church in District 2, that's Miller. One church in District 3, that's Sweeney. 2 churches in, and I had no idea that you all would be here today for this meeting. 2 churches in District 7, that's you, Councilwoman Conwell, and 3 in District 8 where Jones is, and 2 churches in District 9 where Turner, and 1 in District 10 where Stevens is. And we chose those because we looked at the landscape of a lot of violence that happened. It's not just gun violence. It's domestic violence and so forth in the areas of your communities, and it's starting to spill out into the suburban communities. So we looked at those as areas we would start where we would put the churches at.
Okay, so far you have 1, 2, 3, 4, 5, 6, possibly 6 areas where 6 churches would be identified.
No, we identified 10 churches because some, just like Jones area, will have 3
7,
churches, and yours will have
okay,
2.
There you go. Do my math for me. I wrote the numbers. Thank you. So how soon will you have those identified? And is this pastors and ministers determining this, or is this just coming from you to determine?
No, we're the steering committee
Okay.
with them, because included in the 70,000, we will have workshops set up to show them how to do it, especially when it comes to how you call a town hall meeting and how you work with Catholic Charities, YOU, and so forth, because a lot of paperwork needs to be done. So we're choosing churches that already have some form of community workforce development programs or faith-based program, and they have staff already on premises. Because we start with somebody that's a novice, then we will be on the slow track to disaster. But if we work with people that already have done some community-based programs, we'll make all the difference in the world. So we plan on getting started next month. We just wanted to get a signal from you all before we approached them that this was something that was a great possibility.
Okay, and how will you go about your marketing plan?
The marketing plan, once we assemble them to come up with, you mean marketing plans as far as getting the churches?
No, as far as getting the information out for the community to be involved in.
Oh, we have a marketing person that'll be working on staff with us that will get all the information out on a monthly basis, get all the information out that would be in their churches in regards to town hall meetings, all the information out that will be needed to be sent back to Catholic Charities for the food that they're giving us. And then last but not least, all the information to Wow You, who, when they send kids to you, they need documentation that they've been working. So we have marketing people that will be in each church. That's what the workshops will consist of.
Okay, and when you talk about the community awards at the end, will that be 100 in total of each church?
Yeah, at least that. It could be more because we know that we need in-kind services because the 70,000 is not enough. So right now we got another 17,000 committed to partner with this. And some of the churches will even, my experience, they've even given more because they want to have a great presentation. So we may have more people involved with that. So we started with a number, at least 100 people, and we will purchase the awards out of the funding.
Okay, so for the 2 District 7 churches, would the community have to, in order to be eligible for the award, would they be responsible for just showing up for those District 7 churches or all of the 10 churches?
No. Everyone will have their own because we space the churches out so that they have their own exclusive town hall meetings and they don't clash together. It's like Maple Heights has one, Garfield has one, and then in your area, we have it spaced enough so that it's a separate area coming together in regards to the district dealing with the police. So you got a whole separate group coming in for that city.
Okay, and also for the ARPA applications, we haven't had too many that were program-specific, but we request, of course, everything has to go through readings with ARPA funding, and then I guess for me, if it was program-specific, but I think we've asked of everyone that has received ARPA funds to come back and present either midway or at the end of the program, how the ARPA dollars has helped.
No, that's great because one of the things we do, we don't just give, each church is slated to get $5,000 and the other is for budget that we need for people that are working with us and program needs. We will be the person that once they complete an assignment, the assignment they're working on is when they get funded. We won't go give them $5,000. No. Once they start with the literacy program, those that are actually involved in that and marketing that will get the money that they need. Summer-based program, they will get that. And we expect to start next month. We're ready to get started next month.
So I just wanted you to be clear that, you would be invited back, to come back and share how the program is going probably within a 6-month period.
And we'll have documentation from each church to verify what has been done also for you, so it's in the written form.
All right. Open it up for any of my, Councilman Sweeney.
Thank you, Madam Chairwoman. Pastor, how are you?
Good.
You've been doing this for a little while?
15 years. 15 years. And one of the most exciting points is, since COVID, a lot of our churches have been having church on Sunday, and we have a lot of empty buildings. I'm trying to look at ways that we can bring back the church in terms of community-based programs.
You think there's a need out there for this?
There's a big need. Matter of fact, I had a little sheet that I'd given you in regards to 10 churches.
No, yeah, I'm just trying to tee this up
Yeah,
for you.
it's such a great need for it because we've kind of excluded the faith-based organization from doing anything to help towards anti-violence. It takes money. The budgets in our coffers are empty, just trying to keep empty buildings alive. And if we had some help to be able to do this, it not only puts people back to work, it only mobilizes the community to come back together, but then our slogan is bridging the gap with pieces of the puzzle of life. It brings the political element, business element, faith-based, education, and everybody together to work together for the common goal of anti-violence.
Yeah, and through the chair.
Yes,
To me,
through the
it's
church.
No, I have to go through, I'm showing respect in the Robert's rules through the chair to the presenter. That's
Okay.
what I was talking about here. think it's more than anti-violence. It's giving children and young men and ladies the opportunity to change their lives and get through some tough times. So it's life lessons is way an understatement, but it's giving people the path to be successful. And
You know, I appreciate you saying that because being an educator in the school system, I found that when kids have not been able to pass the equivalency test,
yeah,
high school, they don't have a degree, and then they end up going to prison, getting a felony. Where you don't have a high school degree, you have a felony. It's very difficult to be a meaningful citizen if you can't get a job, so you're back out in the streets. So we're trying to have a deterrent that would make the difference in the lives of kids early and be able to provide them some alternatives to grow with the simplicity of programs through the church.
and through the chair to the pastor, it's the validation of the church and the pastor of a voice of welcoming is critical.
Yes.
And you mentioned you're not involved as much, so I'm thankful that you're given the opportunity to use the grassroots already, the foundation that's been there, made over years, hundreds of years, right? That
Yes.
turn to your church, right? And how
Yes.
can we help? And if you get that equivalency test and get a hold of somebody that might be, just needs that one little to change that course, that's the beauty of this.
It
And-
really, really is. If you're familiar with the True to You program, that was a partnership that we had with the Cleveland Foundation,
Okay.
Greater Cleveland Faith-Based Initiative Group, our group, and a couple others that we mentored eighth grade kids for the last 7, 8 years. And in order to do it, it started off slow, but it worked up to over 25,000.
Oh, that's
that were
perfect.
mentored. And the mentors were corporate executives from all around the county that came in once a month to talk with these kids. So it makes all the difference in the world. One, when you have living examples, and then people telling the truth. I once was lost, but something turned me around. I just didn't get to be CEO, but I made a mistake, and that made all the difference in kids' life. That's what we're trying to do.
And gave me the chance. So thank you for the opportunity to chat and answer my questions. And there's a tremendous need out there, and this is a drop in a bucket, and you're going to continue doing God's work and trying to.
And it's just not for, when we say church, we're trying to reach for churches, synagogues, mosques, all of those faith-based work
Faith-based, we'll
that
go
will
with.
work with us. We're just not trying to be one-sided. We're just, the church of the community.
Thank you for, and continue doing the work that you do.
Thank you.
Councilman Miller?
Madam Chair, to Reverend Eppinger, I'd like to congratulate you on your dedication and your willingness to pull together the faith-based community for this highly significant effort. I think reducing and eliminating violence is one of the most important issues that our community, that our country faces. It's just become such a prevalent problem. And my question is whether, if you would share what your thoughts are on why violence is so prevalent, and your thoughts on what kind of things need to be done to prevent it.
I grew up in a community years ago where policemen walked the beat and knew the citizens of the community, and there were things that was happening in terms of private patrol stations that were in the community, and there was relationship. Now we're growing up where children, when you see the police, they run. And then to add to the trauma, with a lot of deaths that are happening to our young people, people are afraid. And we're trying to reach towards how do we come back to work together again. Also, as I mentioned, the absence of employment. When there is no employment, the recidivism rate is so high with people going to jail, coming back home, no employment, they going back to jail again, or they're acting out in the streets and causing a lot of violence that's putting the police on edge, because everywhere you go, there's something going on, people trying to get substance, money to be able to just have food to eat. So what we have to look at is wraparound programs where we can deter people from the violent anger of need and look in terms of getting them re-educated, look in terms of some of the laws being changed where marijuana is causing them to go to jail for a long time when really that substance versus crack cocaine and all that is just ridiculous. And curb some of these employment standards where if you have a felony or you've been to jail, they won't allow you to get employment. So I think that with us working together in terms of bridging the gap with pieces of the puzzle of life, you're looking at political people, business people, government, you're looking at law enforcement, education. It starts us to have a dialogue so we can work together to do something for the whole man, not just dealing with violence, but the whole man. How do we look into, I almost said minister, I'm still a preacher. How do we minister? How do we work with the whole man to create a better citizen? So that's where we are with this.
So thank you for that, and I would just observe that the faith-based community has among the closest relationships with the people at the neighborhood level. So I think you're uniquely positioned to be helpful, and I'm glad that you're involved, and I support this effort on our part to provide some much-needed funding. I would also observe that life is complicated, life is hard, there's lots of disappointments, there's lots of frustrations, there's lots of competition, and people really need to learn effective, assertive but nonviolent ways of dealing with these things, and because it's just a part of life, and so I think that kind of assertiveness and resiliency training is something that should be part of what we do to help head off some of this, so that people can deal with these challenges without getting into violent altercations that just make things worse.
Thank you. I'm just going to ask, if I don't see a show of hands, just the families, Reverend Eppinger, are, there's a lot of families that are in danger of coming into the system in terms of Department of Children and Family Services. And so me and the new director, Jackie Fletcher, has been talking about that both of our mindsets are on what can we do about prevention, right? So we have children that come in daily, or at least weekly, into our care for different reasons or another. But we also want to take a look at how do we put those wraparound services for and prevent families that are on that danger to come into the system, and no one wants that. We don't want it, and they don't want it. So I was just wondering if you would be willing, I don't know what all your program is in depth, but would you be willing to have a conversation with Director Fletcher in terms of this kind of going toward maybe that prevention aspect of what she is starting, basically prevention of the families that they've identified that could cross over into violence, kids going to, neglected. I don't know if they can share that information, but I just think it would be an avenue that you guys can maybe try to identify and see if we could get those specific families into one of these churches.
You know,
To try to-
I don't believe that there's one size fit all. I think wraparound services are the key. When our organization was formed, we really formed with 25 different faith-based organizations, including reentry programs, so that we could make the difference so that nothing gets through the gap of what's missing. And I think once we begin the dialogue, then it could venture to other things, because there are a lot of wonderful organizations that are out here, but the problem is they don't have financial help or sustainability once they get a program. They get a grant for 1 year, and then the good work that they've done has to be put on hold because they don't have continued funding. When we look in terms of government initiative dollars, the larger we can become, the more dollars we can make a request for to look at sustainable programs. Because when you look at the President Biden's, the Kamala Harris, they deal in multi-billion and million-dollar programs. And I think one of the absence on their agenda is faith-based initiatives. I tried to look up models for faith-based initiative, and what it came to is larger denominational churches, but not those that are on the ground actually doing the work. So my hope is that what you said, we can begin the dialogue and the process of coming together where we can bring other entities in and then look at one conglomerate that we can get an ask for with sustainable dollars that will make the difference consistently in our children's life and also the life of our adults who have a lot of problems also.
I don't know if I was identifying money. I just want the conversation, basically, if they can help you identify some of those families and you get those families into those town hall meetings and hear what, you're specifically trying to do. So we can just start the dialogue. Any other questions from my colleagues? Hearing none, seeing none. I'll make a motion for R2023-0126 to go to, is there a second?
Second.
Second from Stevens, to the full council for second reading. All in favor, please say aye.
Aye.
All right. Thank you, Reverend Eppinger.
Thank you for allowing me to come. And let me just say this.
Yes,
Isn't
sir.
it amazing that I didn't know either one of you would be here and they were part of your committee, but the churches I chose are in each of your districts.
No,
Isn't that amazing?
That is
And I did
amazing.
that because I looked in terms of where the trouble was and what we need to do in Cleveland, and I chose those churches. So I look forward to working with you all, and thank you for allowing me to have a moment to say something.
Thank you. We look forward to you coming back. Madam Clerk, if you could read the second item into the record, and let's please recognize that Councilwoman Stevens is in attendance.
Yes, thank you. Resolution 2023-0129, awarding a total sum not to exceed $15,000 to the Village of Healing for the culturally sensitive mental health care for Cuyahoga County's Black women from the District 9 ARPA Community Grant Fund.
Welcome. Please state your name for the record.
I'm Dana Langford. I'm the CEO and Medical Director of Village of Healing and the Village of Healing Center.
Please share with us about your program today.
Thank you all so much for giving me the opportunity to discuss Village of Healing and the Village of Healing Center. Village of Healing is a large umbrella community development organization with a new approach to community wellness. By focusing on healing and empowering the individuals in the village, we will work to eliminate social determinants of health and decrease health disparities through implementing programming, advocacy, and collaboration. We were founded in 2019 after myself and my co-founder, Tanisha Gaines, were working for one of the large hospital organizations here in the city, and we were asked to sit on multiple committees to discuss infant and maternal mortality. Once we got to these committee meetings, we noticed that no one in the room looked like the people in the communities that were being ravished by these disparities. Also, when community-led Black organizations were coming before these committees with action steps and proven solutions, they were being told that they needed to do 5 to 7 more years of research and data, or they were given pennies on the dollars in comparison to the large white-led organizations and hospital systems, where we knew that the numbers weren't changing. We knew as reproductive age women ourselves that we didn't have 5 to 7 more years to give. And we knew that we could not go home to our communities and our villages and tell them, just give them 5 to 7 more years to figure this out. And in the meantime, your baby is still 4 times more likely to die because he is or she is Black. And you as a Black woman are still 3 to 4 times more likely to die due to childbirthing complications. So we founded Village of Healing in 2019 with community programming. We have 2 community programs that we offer. Our Mother to Mother program, where we take Black moms that are currently going through a maternal mental health complication and pair them with Black mothers that are recovering from maternal mental health complications. We give them a peer-to-peer support, and they decide what that relationship looks like. The goal is to decrease the stigma around mental health in the Black community, while also encouraging Black women to seek mental health care. And then we started our Black professional women's group for Black women over the age of 30 with at least a bachelor's degree. What we were finding is that in these same conversations, professional Black women were being left out of the conversation, and that actually lower socioeconomic status Black women were being victim blamed for these maternal and infant mortality rates. But we knew as Black women over 30 with master's degrees that we were actually 6 times more likely to die due to childbirthing complications, and our babies were more likely to die than a white woman with just a high school diploma. And so after that, we started doing some research, and we found out when the new study from Bloomberg and CityLab came out to say that Cleveland, Ohio was the worst place to live if you were a Black woman, and second to last in healthcare outcomes with 3 of the largest hospital systems in this country. And so on February 14th, 2022, we opened the doors of the Village of Healing Center. It is Cuyahoga County's first and only Black-founded, Black-led, and Black-staffed medical center. Right now, we provide obstetrics and gynecological care, and in addition to that, mental health care. Our mission is to deliver quality healthcare services that meet the social and cultural needs of patients, improving health outcomes and quality of care that eliminates racial and ethnic health disparities. Essentially, we are a medical center that provides healthcare appointments with Black nurse practitioners, midwives, and licensed professional counselors for Black women. The data says that when your provider looks like you, your health disparity decreases, your outcome is better, your satisfaction with your care is better, and you leave feeling like you gave informed consent. At February 14th, 2023, we ran our data for the 365 days, and we were able to report that we have seen over 640 patients with over 1,100 visits. We've 17 women delivered under Village of Healing Center, one of those preterm, giving us a preterm birth rate of only 6%. The county and First Year Cleveland have asked for a 10% preterm birth rate, so we've come in up under that. So we have proven in these 365 days that this is a solution, this is the action step, and that we need to focus on culturally sensitive care. In addition to that, with 75% of the women who communicated feelings of stigma about mental health at our intake reported decrease in stigma after 3 mentoring sessions compared to our goal of only 50%. 80% of our mother-to-mother mentees increased their coping skills after 3 sessions compared to our goal, which was 75%. Since opening our clinic in February of 2022, Black women are also seeking mental health support. They are walking into an environment that was intentionally and purposefully created for them. The entire center is colorful. We have a Black art gallery inside of the center that is all local Black artists that have donated their work. Each room in the center is named after a Black person in history with a paragraph to describe each of them, and they get to see people that look like them from when they walk in the door to when they leave. This is culturally sensitive care. And because of that, they're finally walking into rooms with providers and saying, I need help. I am struggling and I need help. After COVID, it has come out that 70% of women, especially postpartum, go undiagnosed or underdiagnosed. That number has not been broken down by race, but I can guarantee you that it is more African American women that we are seeing that is suffering and not being diagnosed or underdiagnosed postpartum. So we hired a mental health counselor in July of 2022. We had to shut her schedule down in October of 2022 because she was over her scheduled caseload. We now have a waiting list that will fill a second caseload, but we're also seeing that Black women are also seeking medication support. And so we're having to refer out, and what we're noticing is there is sometimes a 5 to 6 month waiting list to get patients in to get that type of care. So what we've asked in this funding is to provide money for our psychiatric nurse practitioner. That psychiatric nurse practitioner allows us to continue to expand our access to culturally sensitive care, in turn reducing the barriers to care for Black women. She will see, or he will see, 80 women served with complete intakes, and the goal is to get them in within 3 weeks for that complete intake, and then any medication management moving forward. We have shown in these days that this is the answer. So much so that 2 of those 3 hospital systems work very, very closely with us. We have had several conversations with Metro about how we can make sure that we continue to work together. And Cleveland Clinic believes in our mission so much, they've allowed us to contract one of their MDs who will be starting inside of the center on June 1st, 2 days a week, to make sure that they're able to see those patients that risk out of nurse practitioners' care. And so we're showing that this is the solution. We're showing that culturally sensitive care is what works, but we need to make sure that the members of this community and of Cuyahoga County have access to that culturally sensitive care. Thank you all so much.
Thank you. I was just going to ask, are you connected to any way Birthing Beautiful?
Absolutely. We work very closely with Birthing Beautiful Communities. When our patients come in the door, if they're pregnant, they sign a release of records. I believe in team-based care. And so what happens is by them signing that release of records, it allows us to be able to communicate with the doulas directly as providers, and also bring the patient in to make sure there's a triangular effect of how we're working with our patient. In doing this method, we had a patient that had 3 preterm deliveries prior to seeing us at Village of Healing. By having a doula with BBC and a midwife with Village of Healing, she was able to have her first term delivery. So much so that at 39 weeks, she was begging that we schedule her for an induction because she was so used to having those preterm deliveries. So again, that works. We've also entered into a collaboration known as Black Birth Matters with Birthing Beautiful Communities and Pregnant with Possibilities. And Creating Healthier Communities is also funding us right now with Birthing Beautiful Communities for a $1.28 million project looking at Black midwives, Black community health workers, and Black doulas working with the community.
Right. What's another question I had? Oh, I don't see your address listed anywhere.
So I'm sorry, we are at 22344 Lakeshore Boulevard in Euclid, Ohio. And we've just announced expansion. We're now currently looking into the Buckeye Shaker neighborhood as well, where we will implement family nurse practitioners, so primary care, but we're also implementing a brand new model. It is the first in the state, and it's a PEDS postpartum model. What we're going to be doing is bringing our pediatric appointments, so for that first year of the newborn life, all of those appointments will be with mom for their postpartum appointment. And so they'll have one appointment together in one room and see the 2 providers there. And again, it'll be a team-based approach between that family nurse practitioner, the midwife, and the patient and the child.
Okay, and you said 2234?
Yeah, 22344 Lakeshore
I know I missed it.
Boulevard.
All right. Any questions? Councilwoman Stevens.
Thank you for your work on our behalf.
Thank you.
I see that the focus is getting another staff person,
Yes,
and the total budget is 99,000.
yes,
And you have 15 from Peg's Foundation
Yes.
already, and then you've requested 99 from Mount Sinai.
yes.
And are they going to fund the full 99?
We do not know yet. We have not heard.
So what you receive here today will make sure that you at least meet the goal, hopefully.
Yes.
Okay. All right, you know me, I focus on budget issues if I get the concept, and I think I've got the concept here.
Thank you. Thank you.
Any other questions from my colleagues? Councilman Sweeney?
Thank you, Madam Chairwoman. I just want to say, impressive.
Thank you.
The depth of your knowledge and your passion is just incredible, and you should be commended for it.
Thank you so much. I really appreciate that.
And how did you get it?
So I am a certified nurse midwife.
Just more curiosity. And
Oh, yeah, of course. So I'm a certified nurse midwife. Transparency, growing up, when I would go to the doctor's office, I never saw anyone that looked like me except the front desk staff. So there was a lot of things that I probably should have been telling my provider that I did not because I didn't feel comfortable.
Okay.
And so when I decided to go back to school to be a certified nurse midwife, I wanted to be able to provide that care for young Black girls coming in. And I came from a difficult background. And so I wanted them to be able to hear my story, know what was still possible, and then encourage them as well, which is what I still do in appointments. Encourage them as well to truly seek out what they want to do and not allow their circumstances to rule what their future should be. And in addition to that, I practiced down south for about 6 years, but I'm born and raised in Cleveland, Ohio. So when I moved back here and was hearing the infant and maternal mortality rates for my community, for women that looked like me, something had to be done. And I was exhausted and sitting in meetings talking about it. And so I knew that there needed to be an action step. And if I needed to be that person with my co-founder, Tanisha Gaines, then we would risk it all to do that for our community.
Madam Chair, I'm just more mind boggled by listening to your story. So
Thank you.
It's
Thank
cool.
you.
And the whole midwife thing and being a color, it's just incredibly helpful for the journey of childbirth. And infant mortality is just somewhat disgraceful. I've been dealing with it for 27 years of
Yes.
how can we improve it. We have absolutely wonderful first-class, world-class hospitals in the same zip code as highest infant mortality. We're not pointing fingers. We're just trying to figure out how we can improve it. And you are a shining example of one, and you recognized your partner, two individuals saying, I always use the Popeye thing, all I can stand, I can't stand no more.
Right,
And
right.
you just said, I'm here, I'm doing it, I got my little bit, and I ain't stopping.
Yes. I think it's the investment in community organizations. The pastor before me mentioned it too. We have to invest in people that are actually doing the work and are on the ground in the community and that the community trusts to do the work.
And they know the real.
Absolutely.
I bring
Absolutely.
up street cred all the time, but that's vitally important.
Yes, I can have
right.
way different conversations with my patients now at Village of Healing than I ever could in hospital systems.
I can just say, keep up the good work.
Thank you.
Thank you, Madam Chairwoman, for letting me have that opportunity.
Thank you.
Thank you. I just was wondering, did I meet you before on virtual?
Absolutely.
Okay. All right. Councilman,
Your memory is there.
It
oh, yeah,
is. It's very
it
much
is. That was back at the beginning of COVID, but at that time, we did not have funding, so I'm very glad that it's come around, and Councilwoman Councilwoman Turner, which wasn't a councilwoman at the time, was able to provide some funds for this, so this is ecstatic. Any other further questions? All right. Anything else you'd like to share?
I don't think so. I just want to thank you all so much for this opportunity. I think the biggest thing is we've been asked before, we've thrown a lot of money at infant and maternal mortality, and we were asked this by Case, the Mandel School. We've thrown a lot of money at infant and maternal mortality, and we don't see a change, so what's the difference? And my answer to them was very simple. You're throwing the money at the wrong resources. And so we have to be able to throw the money and get people that are on the ground in the community doing the work and that's able to get through and trust and get the trust of the community to actually do the work. And I guarantee you, from what we've seen as far as during COVID, a lot of these Black organizations are coming around, like Birthing Beautiful Communities, Pregnant with Possibilities, myself. You're going to start to see the numbers go down as far as infant and maternal mortality. And it's because we are on the ground, we are passionate about this. Every day is a fight for us, and we are happy and pleased to do it for our communities.
I have one little tiny extra thing.
Yes, Councilman?
Thank you, Madam Chairman. You used the word trust. Just looking at you, you get their attention,
Thank you.
right?
Thank you, I do.
You need to get their attention to be able to, they trust you enough, get the attention, and then let's focus on the outcome that we need.
Yes,
So I just want to, is that the attention component?
thank
You
you.
need to invest in entities that get their attention and they trust. So
Yes.
I apologize for going a little bit too long, but that just came at
No.
me.
Okay.
Good.
I'll make a motion, or Councilman Sweeney, can you make a motion to,
I'd
move
make
this
the
up?
motion to approve first reading.
And I second that.
Thank
All
you.
right, moved by Sweeney, seconded by
Stevens.
Stevens. I was about to say Turner. I'm mixing y'all up today.
She would.
All in favor, please say aye.
Aye.
Thank you.
Madam Clerk, if you could read the next item into the record, please.
Resolution 2023-0139, authorizing an amendment to a contract with Emerald Development and Economic Network Incorporated for rapid rehousing services for the period January 1st, 2022 through December 31st, 2023, to extend the time period to June 30th, 2024, to change the terms, and for additional funds in the amount not to exceed $902,677.31.
Thank you.
Good afternoon, Council. Melissa Surak, Director of the Office of Homeless Services, requesting a First Amendment to contract with Emerald Development and Economic, Inc. for rapid rehousing services and to add funds. Cuyahoga County Development received a reallocation of federal ESG funds. This project is not new to the county. The Cuyahoga County Homeless Continuum of Care is committed to a low-barrier, housing-first model to ensure that homelessness is rare, brief, and non-reoccurring. When homelessness does occur, households are quickly connected to housing assistance and services tailored to their unique needs and strengths to help them achieve and maintain stable housing. Eden's Rapid Rehousing Program provides access to short-term rental assistance that enables individuals and families throughout Cuyahoga County to move quickly from homelessness into housing. The primary goals of the programs are to move households quickly from shelter to permanent housing using term-limited rental assistance subsidies, ensure that the household will be able to sustain their rent after the subsidy ends, and link households with other services in the community to promote housing stability. Lastly, I think it's important to note that should this move through, this will help assist and support our strategic planning goal 3 of expanding housing stabilization capacity. With me here today, I have Chief Operating Officer Emma Petrie Barcelona to answer any additional questions you might have.
I guess my only questions, Director, would be, I see it's to extend the time period, but were there any specific, it says also to change the terms. Was there anything specific to change the terms in terms of the contract or anything like that?
Councilwoman, there was no change in scope. It was just to add to the additional funds
Okay,
that were awarded through the Cuyahoga County Department of Development
okay.
for Emergency Solutions Grants. So no change in scope, just adding additional funds to expand the rental assistance.
And how much would this additional expansion cover? How many more people?
So Emma Petrie Barcelona, Chief Operating Officer with Eden. Thank you very much for having us today. I can't give you an exact number. The nuance is that the rapid rehousing grants this is part of one that funds rapid rehousing. It funds households for 12 months of rental assistance, but any single grant typically doesn't cover the full 12 months. So what this will allow us to do is ensure that people who are in the process right now of entering into rapid rehousing, that will absolutely be able to cover 12 months of their rental assistance. Okay. So what it'll do, it'll allow us to continue to serve the folks that are in there, right now, at any one time, we're serving about 400 persons in housing. So, or for this program in particular, and then over the course of the year, that is actually closer to 600 households, because again, people enter and then they exit after 12 months. So as the program goes on, we'll absolutely be able to give you a specific number as to how many are served with these dollars in particular. But it's hard for us to tell at this moment.
Okay. Any questions from my colleagues?
I have a question.
Councilwoman?
I'm sorry. I got distracted. You know, the phone thing sometimes catches your attention. Where did we get the additional dollars from?
These are emergency solution grant dollars that technically float through our county Department of Development, but our office is responsible for administering the funds.
So were they going to use the funds for something else?
They were recaptured
From another project or from the state?
from the
of
federal
Ohio?
level.
From the state?
Yes.
Okay. So we needed a waiver from the state to use these funds because they were federal they came from the feds to the state and they didn't use them?
I'm not aware of any waiver that Director Parks Jackson would have completed for that.
Okay, I'll text Sarah.
I'll ask Erin Reardon. She might have something to add from the Office of Homeless Services.
Erin Reardon, Office of Homeless Services. I'm sorry. So came from federal directly to the county. So to my knowledge, there wasn't a waiver that needed to be completed, but you can check with Director Parks Jackson.
Okay, thank you.
And I did want to say, you had a question, Councilwoman Conwell, about the term. So it is extending the term through June of 2024. It's currently through the end of this year.
Will that encompass everyone? All 400 or just for the new that Emma said? Just for the new people that are signing up for rapid rehousing?
This funding will only cover that portion. So
Just that
yeah.
portion, okay. All right. Any other questions? Anything else you'd like to share?
Councilwoman, just noting, one of the reasons we're very grateful for this, but also to note on the Cuyahoga County level, one of the reasons that Cuyahoga County was awarded these additional funds, it's because in the initial phases of the COVID recovery and various recovery time periods, when funds were initially awarded to the county did such a good job spending them and being not just expeditious, but making sure money was getting out there into the community quickly. When the federal government had these recaptured funds from other parts of the country and other areas, this is why our county received almost $1 million from other places. So I just wanted to thank you for that.
I do talk to Sarah regularly, and these were recaptured from the state of Ohio. The emergency rental money was from Ohio not using their share in full, and so she had to deal with the folks from Ohio as well as the feds. So I just need to make sure these were the housing dollars that Sarah Parks Jackson deals with. Wanted to make sure I wasn't looking at different funds. And you're right, this was an absolutely genius move on Sarah's part to find out about these dollars and recapture them for us.
I would also add to Emma's comments that these dollars are specifically also very helpful. Pandemic is over, I guess, as they say, but one of the modifications that we did make to rapid rehousing during that time was extending it to 12 months. So as we've kind of recalibrated as a continuum and as a system, looking at the community level need, as well as the resources that are available, we do continue to struggle to keep that 12 months, but as of today, we've still been able to maintain that, and we're looking to piece together ongoing resources due to the success that we've had with that 12 months of assistance. So I appreciate the support with this item.
All right. I would ask for a motion to move
So
R2.
moved.
All right. It's been moved by Stevens. Seconded by Sweeney. Second. Thank you.
And Madam Chair, is this for suspension or just for second reading?
Let me check that date. I was not asked, so I try to get
I
three
think it
readings.
needs to be
but
suspension.
Probably a suspension. Do you need suspension?
Based on our overall items, we do not need that suspension at this time. I would not urge that unless you, I mean,
Okay,
But-
we're going full readings
All right, there
here.
you go. That's what she wants.
that's a special request, and I take it as such. So,
Right,
no, I
right.
think we'll be okay.
So it's going second reading.
Okay, fine.
All right. So, all in favor to move R2023-0129 to the full council under second reading, please say aye.
Aye.
All right. Any miscellaneous business from any of my colleagues? I would just like to share that the HHS committee and the director, as well as the administrator and the director of DSAS was invited to speak at the last COOP meeting at Fair Hill Partners, and it was great. I mean, we were thankfully invited and shared with them what we've been working on here at the county. So that's the only updated information that I need to share, I guess, at this time. This meeting is adjourned.